This video shows how to use a puffer and spacer using the single breath method for kids. Using a spacer and puffer together is the best way to use your inhaler because it helps the medicine reach your lungs where it is needed instead of getting stuck on the back of your throat or tongue. Take out your spacer and puffer. Remove the cap and check the dose counter. Shake the puffer well. Insert the puffer into the spacer end. Check that the spacer is clean around the mouthpiece. Put the mouthpiece of the spacer between your teeth and close your lips to form a good seal. Breathe out gently into the spacer. Keep the spacer horizontal and press down firmly on the puffer one time. Breathe in slowly and deeply. Hold your breath for 5 to 10 seconds, or as long as comfortable. Then breathe out gently. If more than one puff is needed, take another one by once again shaking the puffer, putting it in the spacer, pressing down once, and taking a slow, deep breath. It's important to inhale one puff at a time. Don't put more than one puff into the spacer at once. When you're finished, replace the inhaler cap to help keep your puffer clean.